COVID changed so many things in our society, and telehealth is definitely one of those things. Patients love it, providers love it, and it is something that could solve a lot of problems in healthcare. But there are so many things that are still question marks. So many policies that have to be worked out, reimbursement, licensing, all of those things. And I think a lot of providers like me have huge questions about where telehealth stands right now. And also, what is happening in the hiring landscape for PAs? I've seen a lot of people talk about telemedicine jobs going exclusively to nurse practitioners. So, what is that all about? And do PAs actually have a role in telemedicine? And do we have opportunities? All of those things I'm going to address with my guest today, who is highly knowledgeable on this topic. She's president of PAs in Virtual Medicine and Telehealth, otherwise known as PAVMT. And she is going to just enlighten us about the state of telehealth and PAs in telehealth. So, if that interests you, you're definitely going to want to stay tuned. Hi, it's Michelle with the Medicine Couch. Thank you for joining me. If you like this video, please hit the like button, share it with colleagues and people who may need this information, and leave a comment down below. Tell us what your experience has been with telemedicine or telehealth, or maybe some of the challenges that you've been facing. All right, now let's hear from my very knowledgeable guest.
Hi, I'm Sarah Gallo. I'm a PA in Denver, Colorado, and president of PAs in Virtual Medicine Telemedicine.
Why don't we just kind of dive in and talk about what the current state of telehealth is actually right now and how it's been shaped going through the pandemic?
Yeah, so I think one of the biggest things that happened during the pandemic was the large adoption of telehealth across the United States and the reimbursement of it. Because I think there is a lot of precursors to telehealth that came out before that, but overall, there was just a large push in order to give access to care.
As provider, what would you say is the advantages of people working in telehealth?
There's a sense of accomplishment that you can provide better access to care. But I also think that's just flexibility for providers. We really do feel, I mean, I personally felt limited making patients come in all the time when I felt like there was an established relationship. I really wanted to just like throw some pointers out there, but I also wanted it to be sustainable for my practice to be able to get paid. I also think that overall, it's more inclusive, and especially rural providers, frontier providers, or people seeing resilient populations, it really allows for more contingency planning to make sure that they get their access. And you can actually see more into their lifestyle and get to better understand what exactly they're dealing with. I mean, sometimes it's just that you don't know. You don't see kind of a lot of the other distractions or environmental impacts that happen at home. Knowing all of that stuff is really helpful to just tailor care. And then on top of that, I think telehealth, it can be provided from anywhere as a provider. You don't have to be in the state. And so it allows for providers to really expand the access to what their specialty is and allow them to work from home. I especially think with the burden of the workforce being so limited out there right now, you can definitely, at least if you're sick, but you just don't want to expose patients, you can actually still see patients on telehealth because you're still able to function and provide care. It's just that you don't want to expose patients to that illness that, again, we're human too.
Yeah.
I also think it reduces the no-show rate. I mean, a lot of times it's just give them a call, ask them to get on video.
That's a good point when you got somebody that is no showing and the front desk calls them and gives them the option. And maybe they do hop on the call really quickly and then you've salvaged the appointment. So yeah, things like that are good tips to bring to administration, right? More ammunition of why this is a good thing to incorporate into the practice and have it all set up. So if you test positive for COVID, but you're not feeling bad, you can still work from home, right, and still see
Yeah, I think
patients.
it
So,
incentivizes us doing what we kind of recommend to patients, which is don't bring it into the workplace.
right.
And if you're a provider that maybe is experiencing some kind of disability or having like an acute situation where you need to just adjust the way that you can work, I think working from home is really a nice option to be able to provide to our clinicians.
And telehealth can be done so many ways. Like it can be your standard practice and you just incorporate a little telehealth, or you could be completely 100% telehealth, but still work in an office, or you could work from home, or you can even start your own business. So there's so many options with telehealth.
Yeah, and I think also it
Yeah.
just requires less resources. So, you don't need a full staff to do it. So you can offer it more outside the regular work hours. There's just a lot more opportunity to really kind of practice in really interesting ways. Sometimes I think feel very limited as a provider in the current traditional model of how we can actually see patients.
Yeah, telehealth is definitely something I think that's needed and wanted by patients and providers, alike, I think.
Yeah, and one of the bigger things that I think really needed to advance, and there's now a push to move towards more permanency, is telehealth policy. So licensing availability to be able to practice across the state lines, more availability for Medicaid, state kind of run government plans.
The PA compact. Will you just kind of tell people what a compact is and how that helps, in
Yeah.
telehealth?
Basically, the PA Compact allows for states that are participating to turn on a license if you have a compact license in their state. So you would have a home state that you have your license in, and then you have access to be able to add more states that are participating onto your PA, I guess, credentials to be able to see patients in other states, but it's reciprocity. So you're not going through the whole full licensing process for the other
Right.
state. It can be done very seamlessly and make it a lot easier for administrators to be able to add states to your license, especially if you're neighboring with other states that are participating.
Yeah, and then that's important in telehealth because as it stands right now, you as the provider, you have to be licensed in the state that the patient is in that you are
Yes.
seeing, right? Yeah.
Yeah, and you can't necessarily see a patient in another state if you don't have that license unless there's specific carve outs for that state because the state has control over who gets to practice medicine in that state where the patient is standing.
So, yeah, the licensure compact. So, I just want to make sure I understand. If you get a state license that from a state that's in the compact, then you go through all that whole application one time with the state you're in, and then you don't have to go through the individual licenses in the other states. They can just, like you said, be kind of added on. I assume you have to pay the normal fees and stuff to get licensed in that state, but it just basically cuts down the paperwork time, right?
It standardizes the requirements up front that are needed to be able to actually kind of get through most of the process. But the one thing that I would say is different from what you explained was that there is going to be like basically an agent that actually you apply through, not through your state, but
Oh,
through
okay.
an agent as a compact agent. And they are the ones that are working to kind of exchange that information with the states that
Okay.
are participating. And there's a baseline requirement, but there's like, obviously certain things with, training, we need some CME and some kind of specific topic, or you need like a supervising or collaborating agreement. Those are going to be that supplemental part that you probably will end up still having to do through the state that you also try to get a
Uh,
license in. But the baseline kind of requirements and process that you would do to get your license in a state would be streamlined and all held under one umbrella. You also have the same deadline to renew. And also it usually does end up being a little cheaper because the resources on the state side are less.
that's fantastic. I'd love to see all the states eventually,
Mhm.
participate in it. Do you know when it would go into effect?
There's about a 24-month kind of timeline,
Okay.
it could happen sooner, but generally that's what they've had in the past is it takes about 24 months to actually get it to the first PA to be able to register and get a license
Uh,
through the compact.
since the pandemic, do you see any organizations, medical facilities that are actually scaling back, or does it seem like everyone's kind of moving full steam ahead on implementing telehealth?
There's a lot that still needs to be done. Telehealth was really introduced and practices were incentivized in a temporary way, and also practices implemented telehealth services in a very temporary way as a means to an end. And so I think a
Right.
lot of those practices are pulling back because there's not a lot in place that's very cut and dry around reimbursement and how it should be documented, what is under the scope of a telehealth visit. But I do see that there is a large amount of like kind of support from the federal government, state governments, and in general, I think investors to really drive more solutions to be focused on access to care. So I do think that there's going to be growth and stabilization of just what that telehealth reimbursement looks like, because I think right now the fear is that it will be overutilized and it will actually end up being more cost. So they're trying to
Yeah.
find fee schedule models in order to kind of control those costs because there is overall a budget for Medicare. So really trying to hone in on what is really appropriate, what's not, and then also making sure that programs are fully scaled and built for sustainability and to grow with the technology that comes out. So I'm really excited to see what happens, but I do think that there will be some inconsistencies for at least like the next 2 to 3 years.
Is telehealth still operating under like some special reimbursement rules from COVID?
Yeah, there's nothing permanently approved through Medicare, which tends to be the kind of common denominator that sets the scale of reimbursement for all the other commercial plans. So there is now coming down the pipe, which I think also will cause a lot of complexity, is new codes that are specifically targeted to tracking those telehealth visits and can just create like maybe a different reimbursement fee that's associated with that, a different RVU. So the PHE kind of waiver is still in place until the end of the year. And what PAVMT and ATA and Center for Connected Health Policy and Alliance for Health Innovation, I think it's called, they all are advocating for adding that telehealth to the Medicare budget because that has to come from a federal legislative level. And then CMS and the AMA coming up with appropriate codes and appropriate value units that are associated with those telehealth to keep it going. Because there is this concern of if it gets undervalued, then it's going to also still be last resort for most practices.
Do you have concerns for people who are working in telehealth right now, or do you think it's got so much momentum that they're going to have jobs in 2025, I guess is what I'm saying.
Yeah, no, I definitely think there'll be jobs. The one nice thing is that there is patient agency and there's patient empowerment and choice. And there will always be choice. And I think we will continue to innovate and create better patient experiences, which also includes telehealth. I
Right.
do think that there's an opportunity for providers to find either a place in their own practice where they can be the champion of making sure that telehealth continues to stay concretely inside their practice as an option, but I also think that everyone is just gonna have to do it at some point because patients are gonna
Yeah.
expect it.
I've seen actually just recently some new platforms. I mean, they're new to me. Other people may be aware of them, but that make it so much easier to do virtual medicine, even if you're like a solo practice or a very
Yes.
small practice. Like they're not that expensive, and they meet all the HIPAA things, and they just make it easy. They have the technology worked out. Do you envision a time where people go to like a drugstore and they buy a little kit that's got a blood pressure monitor and all these things that just plug into their computer and just sends all the information so we can get vitals and all those things? Do you see that being something that just everyone has eventually?
I think that patients appreciate the spectrum of connectivity that some of these devices that they would maybe even just have a blood pressure cuff at home. Now they can get a blood pressure cuff that can now also transmit that information to a provider. I also think like there's some really good benefits with these more lower tech things, but also then having that video and having that accessibility and engagement from patients is that you can actually watch them use their device at home and teach them how to do it properly so you can get them reading the right things, getting the right numbers, and you're actually helping them to troubleshoot when they hit, they know why it's maybe off. I think the biggest barrier to all of it is just the nuance of healthcare information, how it is protected, how it is consented to be exchanged, and especially cybersecurity compliance. There's just so much more nuance when it comes to digital anything, but especially digital
Yeah.
health. I think overall we're seeing just an improvement in technology. We're seeing an improvement in interest to get this care delivered, and then also a prioritization on the reimbursement and policy side, which doesn't always line up. So I'm pretty happy to be, first of all, president of this organization where we can kind of advocate for patients at an industry level and really bring the voice of what PAs want and what PAs can speak from to drive really good policy that also includes us.
This is actually an opportunity because it is kind of the Wild West for us to stand up and become a major player in telehealth. Do you see that for PAs? Do you think that we have the opportunity to do that? And what are some challenges that maybe we face in moving in that direction?
Yeah, absolutely. And I think PAs are part of the telehealth movement. They are stakeholders, and they're also a large portion of the accessible workforce that could provide telehealth. And I think that the industry, given the workforce shortage, there's been a lot of kind of understanding of what PAs are capable of, how important they are to the healthcare ecosystem. And I think that now there's just more of an understanding that we need to actually update our policy, and that's one of the challenges we face. So, having consistency across state lines on how things are licensed to practice our full scope and be utilized at the top of our license. And I think that is the key issue is a lot of these telehealth organizations or even large healthcare systems that operate in multiple states, they're just really having a hard time operationalizing the hiring and the maintenance of PAs as clinicians versus nurse practitioners and physicians, where there's a little bit more clear lines and less administrative burden to maintain those license and to be able to help PAs practice at the top of their license. And so there's a challenge there. But last month we had 90 job postings that we found through our own research that we post on our job board that included PAs as part of the hiring workforce or even targeted towards PAs, because there is a huge interest in hiring PAs because we do provide exemplary care. And I think that the organizations understand that it needs to make sense at their bottom line of how much
Yeah.
resources it takes to hire them.
Yeah, because some of the complexity and the problems that we face is that in most states we still need a supervising physician. But the problem is you can't just have a supervising physician that's going to cover you in all states unless that physician is also licensed in all the states. So it gets complicated. We're not just dealing with one license, we're dealing with two providers'
Yes.
licenses. So I'm hearing from people that when they apply to some of these jobs or they inquire why they're only hiring nurse practitioners, they're being told it's because of the licensing and because the nurse practitioners have independent practice in so many states now. So it's kind of like I think compact licensure, OTP and telehealth, all of it is kind of coming to a head and maybe
Yes.
moving along together.
I think it's making sense with it all coming together for legislators to get behind it. But I also realize, like, if this is going to change, I have to get involved. I have to bring
Right.
my situation to the table to explain to these legislators, or legislators are just getting word of it because they're like, why can't you hire PAs? I hear PAs saying that they can't find jobs. And then the truth comes out that there's these restrictions that are extremely political when it comes to obviously the ability to practice based off our own experience and our own training as PAs. As a precedent, we've been restricted significantly, and it's a lot harder to undo those things versus nurse practitioners. They just get licensing approval through their own board. Physicians have no control over it, and so there's no competing incentives or goals. So I do agree, and I think that a lot of organizations that are in control of these jobs are realizing, I get the dynamic now. I need this to stop. I
Right.
just want patients to get access to the providers that we believe are the best providers to hire. And then same thing, I think that it really puts a risk for the practice when it comes down to, if you lose that physician, you could lose a PA.
Yeah, and I talked to a PA recently who owns a large company, and he would love to hire PAs more. They have some PAs, but their workforce is heavy in NPs, and he says it's because they have to for the laws. So, yeah, the message is that PAs, we need to advocate for ourselves. We need to be involved with our state organizations and contact our legislators, which I used to think was like some big thing, like I wouldn't know how to contact a legislator, but if you're involved with your state organization, They spoon feed it to you. Yeah,
Yeah.
they
Yeah.
give you the email addresses, they tell you how to do it. It's pretty straightforward. So,
Yeah, and I think as constituents, like any pre-PAs sitting out there, they can be part of the solution too to develop more opportunities for our career as well, because you're a constituent of that legislator. You know a lot about what these barriers are. You're looking to get into the workforce and you want an opportunity to stay in your state and tell your legislator that that needs to be changed in order for them to keep you. I also think like one of the big things that we advocate in PAVMT is actually supporting the states that you hold a license in and speaking to the legislators, or at least kind of, participating in the campaigns in each individual state that you have a license in, because you're caring for their constituents. And so this is our way that we can advocate for patients, and it's been extremely valuable. I would also say that telehealth is a huge buzzword that legislators really love to talk about. It's like something not as political regarding like job opportunity, but instead it's about like making sure that you're giving access to care and helping with the overall like generational health of your community. And so we can bring in those two really big important factors under the umbrella of telehealth, because we'll have their ears perked, they will be interested. And then once they realize it's a lot more nuanced, they'll be like, well, if I'm going to get telehealth approved, I need to know all this other stuff.
what advice do you have for PAs to help them kind of push telemedicine forward in their organization? Maybe if their organization is holding back, or if they're in a clinic and they want to kind of be the driver to start telehealth. What kind of advice do you have there?
Clinicians in general just tend to be usually the barrier to adoption of any new things and changes into the
Mhm.
practice, especially when it regards how we deliver that care. So I think developing some buy-in among your colleagues to kind of really say, we want to keep this. How do we keep this? Have those conversations around what really concerns administrators, which is reimbursement, technology, like implementing new technology, understanding compliance and security, and also just understanding the coding and billing. That's what we offer to our members. And then also within our community is really that guidance of really knowing, okay, I can really stand behind this recommendation of like, these are the codes we use. This is how much usually should be reimbursed. This is how long it will be reimbursed for. These are the rules around how we can deliver care. This is the documentation we need to do. And this is the technology that I've had other colleagues really like say are very easy, what the cost is, kind of cut down on some of that really large kind of rework. You can make it a little easier to approach, to feel confident that's a good decision, and also to help with designing and implementing it for your practice. And I really encourage any PA who really wants to push telemedicine that they get on our group, they become a member and get access to all the tools that they're probably going to need to kind of overcome some of those concerns that will get in the way of it being implemented properly and expanding that access to
Yeah.
care.
Yeah. So you're basically saying come with the answers to break down the resistance that
It
the
certainly helps when
administration
you
might have. Yeah.
have the solution when you bring up the problem.
Yeah. And so you said once you're a member of PAVMT, you guys have that information. Like, do you have information as detailed, like by state, or do you have what kind of information can they actually access once they're members that can help them?
Yeah. So we have actually a telehealth PA specific map where you can kind of hover over and you can get access to all the places where all that information sits, some clarification around it with specific websites that have interpreted as healthcare policy experts on what that means. And also, you can always contact us if you have questions. I've had people contact us specifically about like very, very particular unique scenarios, either trying to undo some of this like kind of misinformation that some of the providers or practice administrators have gotten from other colleagues saying that they can't be doing certain things, and PAs being on our group like saying, no, I know this, like how do I explain this to my employer, or like they're trying to take away their telehealth role and make them come back into the office. We certainly can give them the information they need. So that's one of the resources that is accessible only to members. Another resource is the job board. So we constantly every week post jobs all over the United States that offer jobs to PAs, even if it's not necessarily on the headline. We go through each one and kind of actually look through the listing. And then we post it, and there's a newsletter every week, along with there's an entire set of webinars and CME approved presentations regarding the history of telehealth and PAs in it, telehealth billing and coding, and talking about how to become a PA or even open up your own PA practice as a telehealth PA. So we have lots of resources that really, I think, cover the gamut of the questions that we often get, as well as just having lots of subject matter experts in our leadership to be able to answer some of those nuanced questions about practicing and state-related practice questions. So yeah, I think there's a lot available.
Yeah, it sounds like it. Instead of having to hunt all that information yourself, it's
Yeah.
already curated in one place. And then you said that there's like a Facebook group or some kind of community where people can talk amongst themselves, other PAs, and ask questions. Is that right?
Yeah, so that's how we first were kind of developed was through a Facebook group community. And so basically that's a place where PAs really are only allowed to come in, either students or are practicing PAs. And they just post like question specifics and we keep it moderated just so that there can be a way of creating a safe space to talk about these issues, get really very direct information around reimbursement or like how you're getting paid or asking specifically about different employers and really navigating what do you need for malpractice, what do you need to have as a business insurance, how do I start my business, what does it mean to have a 1099. So we've had like a lot of entrepreneurial questions that come through.
That's awesome. And I assume that there's either in the group or on the actual members site as well, like how to do how to do exams, how to do
Yes.
telemedicine, different things in it. Yeah.
Yeah, we
Yeah.
have multiple specialty specific how to
Oh,
do telehealth or what does that job look like? What kind of things do you manage? I certainly really promote the membership because we also bring the lens of that access to care and digital health perspective when the community is actually coming up with what AAPA needs to stand for. And we make sure that first of all, things aren't limiting. And also, we tried to expand kind of the definition of what AAPA would stand for regarding digital health and telemedicine. And we became subject matter experts. So we actually participate in the American Telemedicine Association on behalf of AAPA to make sure that we are engaged stakeholder in the conversation as far as get
yeah.
government relations and any kind of innovation coming through. Just really, I strongly urge people to kind of think outside their little bubble of the PA world and say, not everyone else, especially legislators, know how to practice medicine and what's the best thing for patients to prioritize. There's
Yeah.
many, many stakeholders trying to get things passed in healthcare policy. And I think clinicians need to advocate more as the expert to these legislators on what to prioritize passing in
Yeah.
bills.
So much stuff. And it sounds like you guys really offer a lot of value. How much is a membership and how long do you get a membership for and how do they sign up for it?
So you can go to our website. We also have a discount code through Medicine Couch. So happy to offer that. Also, you'll be helping to support Medicine Couch, which we fully advocate for. We have a fellow membership that gives you access to everything. Also, you can be on a directory so that you can find other people in other parts of the field. And that is $150. And it's I think a 10% discount for those who use the code. Students, there's membership and you get access to the same stuff. You just don't get the CMEs. Pre-PAs can sign up. We also have the availability for other healthcare professionals to come in. And as we see that training needs to be incorporated into the academic institutions that are training our future PAs, we actually developed an entire separate membership for academic institutions. Many schools are members so that they give their students a module on telehealth and also practice use cases where you can actually do a mock telehealth session. So we're really trying to encompass pretty much all the aspects of how telehealth will really need to be fully adopted is empowering providers to really know how to do it, be really good at it, really stand behind it, understand what needs to change in order for them to be able to incorporate it permanently into traditional healthcare models. Because again, I think that's what needs to happen.
Sarah, you have shared so much great stuff. Thank you for being with us today.
Yeah, thank you so much.
Now, if you're interested in telehealth, you might want to check out this video here. It's another PA who shares a lot of tips and information about telehealth, including some tips and tricks on how to do physical exam through a computer. Well, thank you so much for joining me today. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.